In the males, we call it as the vasectomy. In the females, we call it as the tubectomy. Okay. So remember, vasectomy is done in the males. Tubectomy is done in the females. So vasectomy, it's a small part of the vasa differentia that is removed or tied up through a small incision on the scrotum. So you can see here, so whatever the vas difference is there, it was cut it down and tied up so that the sperms which are formed in the testes, they cannot go out through the vas difference. So if the vas difference is connected, the sperms can travel it. But I am cutting down it and I'm tying up. So whatever the sperms are there, they will be left in the vasa difference. They will not go upward. So that's how you're preventing the sperms to go to the semen. So where does the semen will be formed? Semen will be formed here. Sperms will be formed here. So it has to go through all these paths and the sperm should mix up in the semen so that they will be released out in the female reproductive tract. Right. So remember, in vasectomy, the vas difference is cut and tied up. Okay. So what is vasectomy? It is a surgical method that takes place in the males where vasa differentia is removed or tied up. Okay. So by making a small incision on the scrotum, that means they will put a small hole in the scrotum and they will send that device will be helpful for cutting down this vasa difference. Okay. So remember that. So why do we do that? To prevent the transportation of sperms. So prevent transportation of sperms. Okay. So remember, so why do we do the vasectomy? To prevent the transportation of sperms. Okay. So remember, this is a surgical method for sterilization in the males. Okay. Remember this word sterilization. So why we call it as sterilization? What is meaning of sterilization?
Infertility.
Yeah, the infertility. If you take the other contraceptive methods, they are not making the male infertility. If we stop using those methods, still the male is able to send his sperm so that the female can become a pregnant. Okay, so the male is still fertile in all those conditions. But in vasectomy, the male becomes sterile. Okay, he will become infertile. So it's a irreversible process. So this blocks the sperm from entering the ejaculate and prevents. So what is vasectomy? So where the small part of the vasa difference is removed or tied up by small incision so that the sperms cannot enter into the ejaculate, cannot takes place pregnancy. Okay, remember this one. Efficiency for this, it is 99% effective. So why it is 99%? Why that 1%? There is a chance for the whatever the cut down vasectomy is there, they can reunite and they can form a tube again. So that's the result of that 1%. Okay. So cannot be easily reversed even if couples want to conceive later. So remember this. But still there is a process where the reverse can happen. But it is not that effective. Unsuccessful method. Even if they want to try to reunite whatever the cut vasectomy is there, still it is unsuccessful. So what is the constituent of semen? So we know semen is nothing but sperms plus secretions. So secretions from seminal vesicles, secretions from prostate gland, secretions from bulbourethral gland. In this vasectomy, are we just preventing only the sperms or we are also preventing the secretions from all these? Can someone guess?
We are only preventing the sperms.
Yeah. So if you see these seminal vesicle, prostate gland, bulbourethral, they were all secreted after the vas difference, right? So we are just eliminating only the vas difference. So the sperms cannot. But seminal vesicles, bulbourethral gland, prostate glands, they are present after the vas difference. So these secretions are there. So semen can be produced, but only that semen doesn't contain the sperms. But all these secretions will contain. So remember, in vasectomy, we are just only preventing the sperms, but semen will still exist. So whatever the secretions from seminal vesicles, prostate gland, bulbourethral gland, they still remain, okay, in the ejaculation. Remember, so semen without sperms is ejaculated after the vasectomy. Okay, so before vasectomy, semen plus sperms. After vasectomy, only semens, but not the sperms. So vasectomy eliminates only sperms from the semen. But still, whatever the secretions of seminal vesicles, prostate gland, bulbourethral gland, they still exist in the semen. So that's about the vasectomy. Next one is tubectomy. So tube, that means we are talking about the fallopian tube. Ectomy, it's a surgical removal. Okay. So what is tubectomy? It is a surgical method for sterilization of the female. So remember, tubectomy is performed in the females. It's a surgical method where we are doing the sterilization in the females. So remember, tubectomy is a surgical methods for female sterilization. Okay. So what we are cutting down here, we are cutting down the fallopian tube. We know the ova will be released here and it has to travel all this process. Okay. So where we are chopping down the fallopian tube so that the ova cannot come to the ampulla region where the fertilization takes place. So the contact of the sperm and ova will be prevented. Okay. So how do we do this? A small part of the fallopian tube is removed or tied up through small incision in the abdomen. Okay. We are doing incision in the scrotum, whereas in tubectomy, we are doing incision in the abdomen. Remember this. Okay. So in
I have a
vasectomy,
question.
incision is done in the scrotum.
So I have a question.
Okay.
In females, when there is ectopic pregnancy, is tubectomy performed?
See,
Yeah.
so what they do is actually they send a small pipe, okay, through the vagina. So that pipe will reach to that and they will try to abort it because ectopic pregnancy is very dangerous for the female.
Okay, sir. Thank you.
So remember tubectomy. So where we are doing incision in the abdomen and we are cutting down the fallopian tube and we are tying it up. Okay. So that whatever the ova is there, it will not come in contact with the sperm. Okay. So that's called as tubectomy. It's a surgical method that takes place in the female to make the females sterile. It is an irreversible process. Okay. So remember this tubectomy is also called as tubal ligation. So it is also called as tubal ligation. This is how the egg will go, right? So we are cutting down here so that the incision is happened and we are tying it up. So whatever the sperms will come here, they cannot come in contact with the ova. So hence fertilization cannot happen. So remember, two small incisions on both fallopian tube. We are not just making it for one fallopian tube. We are making for the both fallopian tube are made. Okay. So two small incision on both fallopian tube are made. Okay. After that, what we do? So after making the incision, what we have done, we are tying it up. Okay. So the ends are sealed. So we are sealing it. Okay. So that transportation of ova is prevented. So transportation of ova is prevented. Hence fertilization cannot happen. So zygote formation cannot happen. So vasectomy is 99% effective and it can be easily reversed. The female cannot conceive even if she wants to. So reverse technique is usually not successful. Even if somehow the doctor tried to do the reverse, it is mostly unsuccessful. And remember, vasectomy and tubectomy do not affect the sexual acts. Okay, they will not affect any way in the sexual process. What if the female was got pregnant, and how do we terminate it through medically? Okay, so that's called as medical termination of pregnancy, which is also called as MTP. So what is MTP? It's a medical termination of pregnancy. So why does we want to terminate the pregnancy? Maybe it's because of unwanted pregnancy, failure of contraceptives used during the coitus. Okay, so that led to the pregnancy, but still it's unwanted pregnancy. We want to terminate it. Second one is it's due to the rapes or unprotected sex. Okay, and the third one is abnormal fetal growth. So after the scanning is done, the doctors get to know that the fetal was not healthy. It's abnormal fetus or there is a scene of abnormal fetal growth, so the doctor want to terminate it. Okay, because it is harmful for the mother or even the fetus cannot survive after birth. So in that, the doctors need to take the decision of the termination. Okay, so these are the three ways why the someone wants to go with the MTP, medical termination of pregnancy. One is failure of contraceptives, so unwanted pregnancy. Second one is due to the rape, so that's also unwanted pregnancy or unprotected or contraception failures. These all led to the unwanted pregnancy. And the third one is that's a continuation of pregnancy being harmful for mothers or fetus because of abnormal fetal growth. Okay, that could be harmful for both the mother or the fetus cannot survive after the birth. So, in that condition, the doctors want to do medical termination of pregnancy. So, MTP, it's a voluntary process because the pregnancy is not happen or the termination is not happen naturally. It was the one's decisions, either the individuals or the together with the doctor decision. Okay, so it's a voluntary termination. So we call it as the induced abortion. That means we are inducing the abortion by the giving the drugs so that that drug will induce the abortion. Okay. And it was legalized in the India in the 1971. Remember, this one is very important. Okay. So MTP, medical termination of pregnancy, was legalized in India in 1971 by Indian government. But there are given with a strict restrictions to prevent any misuse. So what can be the female feticides? So all these can. Okay. So remember, it was legalized in the year 1971 with a very strict restrictions by the government of India. Okay. But still, it's a topic of debate because many of the countries, the people think that it's a gift of the god. So socially, emotionally, so moral, it's not moral. And even there is certain religious issues. Okay. So that's why it's a topic of debate in US or Indian. Okay. But in us, it is in 1971, it was legalized to have a medical termination of pregnancy. Okay. And if you see the count or the statistics of the MTP, 45 to 50 million MTPs were performed every year. That accounts one fifth of the total number of conceived pregnancies. That means one fifth of the part of the pregnancies were terminating with the help of MTPs. So that's a very high number. So how do we do? So medical termination of pregnancy can be done either by surgical method or oral method. Can someone tell me what is the drug that we use for oral? I told you that's a strong drug that we use after 5 days. So most of the progesterone hormonal drugs that we use to prevent just within the 5 days. So that we are trying to prevent the implantation. But still, implantation has happened. The zygote was implanted into the female uterus. Then, what is the drug that we are using to prevent that or to uh, just eliminate that implantation? What is that drug?
I pill, I
Hmm?
pill,
Yeah,
I pill.
I pill. That is still within the 5 days. Remember the word mifepristone and misoprostol, which is a strong antagonist for estrogen. And misoprostol, it's a strong inducing smooth muscle contraction. So this will induce the smooth muscle contraction. So whatever the smooth muscles are there in the in the female uterus, in the myometrium, they will undergo a strong contraction. So what happened when there is a strong contraction? Whatever it's there in the uterus, it has to eliminate out. So whatever that implantation has happened, we are inducing with a smooth muscle contraction, trying to eliminate it out. And mifepristone, so whatever the implantation has happened, so that implantation will happen by the thickness of the endometrium. But we are trying to prevent that thickness with the help of strong mifepristone. So that the implantation, whatever is attached, again it will reattach, it will deattach from the to the uterus wall. So it will just present in the female uterus, and due to this smooth muscle contraction, whatever that detached one is there, it will be eliminated out. If it is at the early stage, so entire mass will be eliminated out without any burden. But if there is a growth in this, like after 2 3 months or after the first trimester, so the preventing sending it out is very difficult. So when it is very difficult, some part of that will be remain in the uterus. I told you that, and that has to be surgically eliminated out, right? So that's how we use the mifepristone and misoprostol for medical termination of pregnancy by oral method. So what will be the risk factors? So the first trimester, it is relatively safe, but if it is in the second trimester, it is very riskier. Okay. So remember, MTPs are considered safe when you take between the 12th to 24th. Okay. So remember, this is the time where it is used. Okay. So up to 12 weeks of pregnancy or up to the first trimester, it is relatively safer. But after the second trimester, the abortion is very riskier. Okay. So remember, okay. So remember, MTPs are considered relatively safe during the first trimester. Okay, that is up to 12 weeks of pregnancy. That means just before 3 months. Okay, but after 3 months, it becomes very difficult. So the pregnancy is divided into three trimesters. So first trimester, second trimester, third trimester. First 3 months, second 3 months, third 3 months. Okay. So first 3 months, we call it as first trimester, second 3 months, and the last. So till here, it is safer. But once the pregnancy crosses the first trimester, it becomes very riskier for the mother. And there is so much of misuse for this MTPs. One is it is done illegally by unqualified quacks. That means the stupids, idiots. Okay. So that is risk for both for the mother. Okay. It could be fatal for mother due to the eye bleeding. Okay. So there will be severe bleeding happen, unstoppable bleeding, so that it can lead to losses of blood, hemorrhage, and that result in death of the mother. Okay. And it is most useful for female feticide. So these are the misuse of the MTPs. One is fetal sex determination is determined after fetal sex determination. If the parents got to know that it's a female and they are undergoing this female feticide in the ancient days, in last century or the before centuries, where you can see the large number of cases where female feticides used to happen. And the next one is by unqualified CACs or unqualified doctors. They used to do this, and that result in death of the mother. Okay. So these are the two misuse of the MTPs. So what is female feticide? So what is female feticide? It is the process where selective abortion is done. Why we call it as selective abortion? Because it's the choice between the male or female. If it is male, they continue with the pregnancy. If it is a female, they will undergo abortion. So that's why it is called as selective abortion. Okay. So it's a illegal practice where the pregnancy termination is happened due to the gender biased. Okay. And there are very strict laws against it. And even the penalties were imposed. And even the doctor who perform this, their license will be withdrawn. Then what is the other reason? What are the main reasons for female feticides? One is there's a male favored for successful lineage. One is dowry system. So if they get the female, they cannot afford this dowry. So they always try to have the male child instead of female. If there's a female, they try to go for the abortion. So girls are not safe, lack of education. So all these things. Okay. So here's the question: vasectomy and tubectomy. So what does it do?
B. Prevent gamete transport.
Yeah. So in that, are we trying to inhibit the hormone production? No.
No.
Are we preventing the gamete production? Like the production of the sperms or the production of ova is inhibited? Nope. They're still releasing. But the fertile region where it happened, we are preventing the gametes to reach there. So it's option B, prevent gamete transport. So if you see the female feticide, okay, the females to male sex ratio in India. Okay. So due to female feticide, there is a 94.1 females for every 100 males in the year 1960s. And if you see in 2020, there is a 108 males for every 100 females. That means the males were majority in number compared to the females. And what is that cause? The cause is due to female feticide. Okay. So if you see the ideal sex ratio, the sex ratio of ideal is the number of males and females should be equal. It should be in the ratio 1:1. That means every 1,000 males, there should be 1,000 females. Or every 100 males, there should be 100 females. The number should be same. That's the ideal sex ratio. But due to female feticides, the female number was decreased and the male number was increasing. Okay. So those are the reasons. But why does actually the medical termination of pregnancy MTPs are used for by the doctors? That's due to the congenital anomalies. Okay. That is nothing but birth defects before giving birth. Okay. So there is a medical or fetal defects during the fetal side. Okay, fetal is. So what does this? It can be the baby is born with the cleft lip, that means opening in the upper lip, or the kid suffers from anencephaly, that means the brain is coming out. You can see the neural tube defect. And the third one is the spinal is coming out of the region. Okay, so the kid suffers with the spine bifida, a protruding structure. You can see there's a protruding structure. The spine is coming out of the abdominal region. So the spinal cord is seen in these cases. So there can be a chance that easily it can be affected with any physical trauma. Or it can be the child has Down syndrome. It's a genetic disorder that we'll be studying in the next chapter. The next one is the kid is born with a clubbed foot. You can see the feet. Either it is swollen or it was just not aligned properly. Okay, so these are the defects where it was found early by the scanning or somehow. Then the instead of giving birth, the child is aborted. Okay, so next one is gastrulation. Can someone remember what is gastrulation?
It's the formation of three germ layers, ectoderm, endoderm, and mesoderm.
Okay, so just write this definition here. Congenital anomalies. What does that mean? It is the birth defects where structural or functional abnormalities are seen. Abnormalities that occur during intrauterine life. So write down this definition. So what is birth defect or congenital anomalies? It's nothing but the birth defect that's seen structurally or functionally abnormalities during the intrauterine lives. Okay. So what could be the structural? It could be like the art defect. The art is not well formed. Okay. Or you can see here the cleft lip. Okay. Or the cleft palate where the mouth is open. The roof of the mouth is just open. Or it could be functional anomalies like their metabolic disorders are seen. Okay, that's a excess urea or excess of electrolytes are present in the blood. Okay, or there could be any sensory defects like the person is born with a hearing loss or loss of vision, blind. Okay, or even intellectual. You can see here this one. Okay, so the Down syndrome where the development and intelligence was not seen. So he is growing up, but still mentally is not intelligent. Okay, structurally is not well developed. So those are all comes under the Down syndrome. Okay, so these are the congenital anomalies. So write down this definition. So yeah, tell me what is gastrulation?
So it's the formation of the three germ layers.
Yeah, that's called as gastrulation. So we know there's a blastula, right? So that blastula is developing into the gastrula. So we call it as gastrulation. So whatever the blastula is there, it is developing into the gastrula. We call it as gastrulation. Okay. So what happens in this gastrulation process? The fluid will accumulate in the fluid accumulation will takes place. Where does the fluid accumulation will takes place? You know, the epiblast and hypoblast. Remember, what is epiblast and hypoblast? The inner cell mass will develop into the epiblast, right? So whatever the inner cell mass is there, so we know it was differentiated into inner cell mass and outer layer. So that inner cell mass will will develop into epiblast, right? During the embryonic development. And this inner cell mass is just covered with a hypoblast, right? So this inner cell mass, whatever the epiblast is there, it will turn into three layers. That is ectoderm, mesoderm, and endoderm. Okay, but during that process also will be fluid accumulation will takes place. So that fluid accumulation and development of three layers, that entire process we called it as gastrulation. Remember? So remember, gastrulation, it is a very important process. It's a very critical process that happens in the third week of development, where epiblast will turn into three layers protected with a fluid accumulation layer that is called as gastrulation. Okay. And that fluid, we call it as whatever the fluid that accumulates in which cavity. What is that cavity called? What is this cavity called? Amniotic cavity. And this amniotic cavity is filled with the amniotic fluid. So we call this fluid as Amniotic fluid. What is the use of this amniotic fluid?
Sir, is it to protect the fetus?
Yeah, it acts like a cushion for the growing fetus. Okay. So the fluid also contains the nutrients, antibodies, hormones. Okay. So it's a protective liquid that is present around the fetus in the amniotic sac. So amniocentesis. What is amniocentesis? So it is the test. We call it as the prenatal test as it has done in the natal stage or it is done in the fetal stage. So remember that test is called as prenatal test. Okay. It is based on the genetic makeup of the cells from the amniotic fluid. We know that amniotic fluid is containing the fetal cells. Okay. So these fetal cells, okay. So we'll be taking those fetal cells. So in that fetal cells, we will isolate the DNA and we'll test for the chromosomes. Okay. So it is used in the sex determination as well. So that we are extracting the chromosome. So we can see either it is XX test or XX chromosome or XY chromosome. Okay. We know the 23rd, if it is of the same size, we call it as the XX chromosome. If the X is bigger and we know Y is smaller, so that can tell it is a male. So through that way, we can also determine the sex. Okay. But actually, why we are doing that test? In order to find out any fetal disorders. Okay. So when does it done? It will be done in the 15th to 20th week of the pregnancy. Remember this, the test will be done during the 15th to 20th week of the pregnancy. So tell me, does it comes under the first trimester or second trimester?
Second.
Second trimester.
It will come under
Second.
second. So amniotic fluid sample is taken from the mother and tested. Okay. But there is a one drawback or risk factor, so it can lead to the miscarriage. Okay. So remember, when this there's a 1% chance for the miscarriage. Okay. Can happen. So next one. So what is this amniocentesis? Okay. So amniocentesis is the test that performed to detect any birth defects like Down syndrome, spina bifida. Okay. Or sex of the child can also be seen. Okay, but this is not the main purpose for doing this test. The main purpose is to find out any chromosomal defects are there, any genetical disorders are there. Okay, any congenital disorders are there. Okay, so what is the step? First one. So the doctor will do ultrasonography. Okay, so where he will do the ultrasound testing in order to detect whether the baby is there or not. Okay, so once that is done, he will insert a small needle. So you can see here. Okay, gently. So when you start inserting it, when it reaches to the amniotic cavity, there will be some fluid will start entering into the needle. That's how the doctor will get to know that, okay, our needle has reached up to the amniotic sac. He has to go very gently, because if he go very fastly, what happen? It can puncture the amniotic sac and it will also lead to lose of all the fluid out. So he has to go very gently. He has to make a very gentle incision. Okay, and then he has to take the sample out. That sample is called as amniotic fluid. And then he will take it to the lab and he will extract the fetal cells and he will see the chromosomes. Any defects are there. Okay. So remember, advice of the amniocentesis. So the mother age should be more than 35 years. Abnormality found by ultrasound. So why do we use? Okay, if the mother age is not young and it is more than 35, then we need to do it. Next one is abnormalities found by ultrasound. So we need to see any congenital disorders are there. So we'll do that test. Okay. And the third one, if the previous pregnancies having genetical abnormalities, then there is a chance for the present pregnancy can also have. So we need to do the test. Okay. So in that condition, these tests will be done. And if there's any family histories, get to know that the family, their parents are having any genetical disorders, in order to know that this test is done. Okay. So now tell me, what is the ideal sex ratio? What is the ideal sex ratio?
1:1, sir.
Yeah,
Me.
it is 1:1. The number of males and females should be equal. So that's about the contraception. Okay. So remember, why does we do contraception? Why does the contraception is essential?
To
What?
prevent unwanted pregnancy.
Yeah, to prevent unwanted pregnancy. But why does the government has introduced that contraception methods?
To control the population.
Yeah. So first one is for control the population. You can say the curbing of population or the halting of population growth that is happening very rapidly. Okay. And it's also providing the birth control options to prevent unwanted pregnancy. Okay. So that the people will be aware for the chances of unwanted pregnancy and even for controlling the high population. Okay. And remember, so when we are using the different techniques, so one is premarital, like the barriers and chemicals contraceptives will be using before the marriage if the couples were involving in the sex. During the after the marriage, if they want to not to have children yet, then they can use the reversible contraceptives. What are the reversible contraceptives we can use? Barriers. We can use chemicals. Other than that, we can also use IUDs, intrauterine devices. Okay, and natural methods. By what are the natural methods?
The rhythmic method.
Yeah.
Natural
Okay.
assistance.
Yeah. To track the menstrual cycles
Avoidance
and
in
what is the
concepts.
risk period, what is the fertile period, and preventing the copulation during that time. Okay. After the marriage method, after the marriage, after the having child. Okay. Then if the male and female want to have a complete, in order to have a complete eradication or method, they are undergoing through surgical methods. Okay. So not to have a children anymore, then they will undergo this tubectomy, vasectomy process. Okay. So remember that. So what are the total different contraceptive methods? One is natural, barrier, surgical, intrauterine devices, and the chemicals. Okay. So in the surgicals, we have the vasectomy and tubectomy. Okay. So that's about this.